pleurisy or pleuritic disease of the pleury. There are two lungs in human body, and each lung is covered by two layers of membranes called as pleury. The innermost layer, which is called as visceral layer, which engulf and wrap the intimately all the lung surface of either lung separately. Similarly, there is an outer layer of the pleury which is called as parietal layer, which lines the anterior of the thoracic cage. In between the two delicate membranes layers of the pleury, there is a lubricant, small quantity of lubricant, which acts as a cushion for the underlying lungs. That is, they provide protection to the lungs from the exterior compressions or injuries. When these are healthy, there is no obstruction in the respiratory system. I mean, inspiration, expiration is normally going on in physiological fashion. And these two membranes, they are protective layers for the lungs on either side, left and right lungs. But in certain diseases, which is called as pleurisy, that is inflammation of these two layers which engulf the lungs, undergo inflammatory changes due to the various reasons which I am going to mention. They become inflamed, swollen up. So there is a friction when there is respiratory phase, especially the inspiration, that is the deep breath. So this friction rub between the two layers, visceral and the parietal pleury, that produces a severe pain which is called as stabbing and tearing pain to the patient. Now, inflammatory process is due to certain reason. The etiology of the pleurisy is infective. I mean the various infection of the various pathogens like viruses, especially influenza, parainfluenza, rhinovirus, adenovirus. These viruses, they produces inflammatory process in these layers or pleury. Next is the bacterial and fungal ones. They also produces, but mostly the cases belong to the viral pleurisy. The most common pathogens in bacteria is streptococci, especially from the sore throat infection, and staphylococcus infection from the septicemia, that is blood-borne infection. In addition to the infected pleuritis or pleurisy, there are other diseases of the lungs itself, that is pneumonia, TB, cancer, atelectasis, asthma, and other chronic diseases like the occupational diseases, and also the external injuries to the chest wall. They also damage the anatomy of the pleury. In addition to these, autoimmune diseases like lupus and rheumatoid arthritis, and also in sickle cell anemia, and also pulmonary embolism, which is produced due to the heart diseases. There is embolism in the pulmonary circulation. There is obstruction one, which also causes inflammation of the pleura. So these are the main factors which produces inflammation of the pleura layers, that produces pleurisy. And when pleurisy is produced, the function of the lungs on either side, whether it is a bilateral or it is unilateral one, the function of the lungs, that is inspiration and expiration, is disturbed and is become very painful one. So it is the main hallmark or the key point of the symptom is in the patient is the severe pain that is observed by the patient in this process or disease of the pleurisy.